Nigeria's health sector is once again facing a crisis. Resident doctors are heading on another strike, and this time it's indefinite. Evelyn Akaka reports.
As if contending with the coronavirus pandemic wasn't enough, Nigeria's hospitals are about to face even more challenges. Resident doctors across the country are going on strike. They're fighting for better working conditions and are demanding payment of overdue salaries and allowances. They say the government isn't listening to their demands. These doctors account for more than 80% of the medical workforce. Without their support, consultants can't manage the workload and patients are left unattended to.
Some state government also have not paid its members, some owing them up to 19 months, some 10 months. And these are part of the things which government had agreed they were going to intervene, to ensure that our members were paid. Beyond that also is the Residency Training Act, which government also had agreed they were also going to pay, which we are yet to see for 2021 year.
Many of the problems facing the healthcare system can be linked to a lack of proper funding. Less than 4% of Nigeria's 2021 budget is allocated to health. That's despite a pledge made in 2001 to allocate 15% of the budget to healthcare. This is the third time this year resident doctors are going on strike, but it's changed little in the past. These resident doctors now want long-term solutions from the government.
Government also needs to do the same thing which we have in the judiciary, where a certain percentage of the budget, a substantial amount of budget, is constantly kept exclusively for healthcare. It has to deal with remunerations of staff, equipment, creation of maintenance of equipment, and it should not just only be limited to the federal government. It should also span down to state governments.
Millions of Nigerians struggle to gain access to adequate public health services, which are often free in other countries. Now, resident doctors are hoping their strike action forces the government into improving healthcare for all. Evelyn Akaka, Arise News.
Well, let's bring in Dr. Julian Ojebo, the former first vice president of the Nigerian Association of Resident Doctors. Thank you so much for joining us on Newsnight. Well, the reports have more or less, shed quite a lot of light on the plight of the average Nigerian medical doctor. But the question that, people continue to ask every time NARD or resident doctors or doctors in general ask is, what will be the fate of Nigerians? I mean, we're having to battle COVID-19. We're now officially in the third wave of COVID-19, and so many other issues plaguing the health sector. Why now?
Yeah, thank you very much. Yeah, like we've always said, that when issues like this actually come up, elected officials into government and appointees of government are the ones that are actually supposed to provide or prefer answers to these raging questions. Okay, sometime this year, sometime in April, there was a memorandum of action that was signed at the instance of the Minister of Labour, where 6 items were actually given for actions to be taken upon. Now, the 6 actions were taken out of the 13 in the communique that was given to the federal government. As we speak today, not one has been completely resolved. Now, let's start from the first one. Yeah. Payment of house officers. Okay, we still have pockets of house officers that have not been paid from January till today. 1. 2. Payment of doctors on this payment platform they call the GIFMIS platform. Doctors all across the country, now we have like 78 of our member chapters all over the country. Members of our association have still not been paid their salaries. We're not talking about COVID hazard inducement allowance, which the government has reneged upon. We're not talking about hazard allowance itself, which the government has actually reneged upon. We're talking about their basic salaries, and it's not been paid for over 6-7 months. That is another aspect of it. Now, most of our members that died owing to the COVID-19 infection. As at the last count, we have 19 of them. Now, we've been going to various agencies of government, meeting different members of this government, and we've been telling them that, okay, we've lost our members, 19 of them. When it was time for Nigerian doctors to actually combat COVID-19, Nigerians called upon the doctors, and we responded. In the crossfire of COVID-19, we lost 19 of our members. Now, how do you motivate the others in the third wave to actually move ahead and say, okay, we want to put our lives out there to actually fight?
All right, Julian, makes sense what you're saying, and one could sympathize with the doctors. But then she talked about the patients. But let me talk about another thing. Change is the only thing that's permanent. Why is it that it has to be strike all the time? Isn't it possible for the doctors to find another way to, make known their grievances aside always going on strike? This is the third time.
Without jeopardizing.
Yeah, okay. Now, let me actually take your question in depth. Now, we've used various avenues to actually bring forward our grievances. Like what? Like what? We've come to you, we've gone to the media, we've told the Nigerians, we've told the Nigerian population that these are the problems that bedeviling the health sector, and nothing has been done. Now we've gone through diplomacy, nothing is working. So what do you prefer to us that we use? The only language from 1983 till today that the Federal Republic of Nigeria understands is that when doctors down tools and say, we cannot tolerate any of these any longer, then they are now forced to listen. Sometime in April. It
seems like it's not solving it. That's why.
Yeah, because it's not solving it, because people like you will tell us that because of the patient, let's call off the strike. We'll listen to you. We say, okay, let's continue diplomacy, let's continue talks with the government, and then they don't respond to it. How do you want those people to feel? They have families to cater for, they have kids to pay bills for, and all the parade of them.
You're still here. We'll get back to you. All right, Angie.
All right, do stay with us. There's more to come. We'll return to this discussion when we return. Right, welcome back. We're still with Julian Ojebo, immediate past first vice president of NARD, that's resident doctors in Nigeria. While we went on that short break, we're trying to, explore some issues about how government has been responding to this. You said you had a meeting about 2 weeks ago, and we were wondering exactly what, government told you 2 weeks ago that you had to resort to this strike today. And why are you not even tackling the state, governors? I mean, some states are owing upwards of 19 months, some 8.
10 months.
Okay, now the issues of the state governors, at this point, I think we need to say there's some governors that are doing very well. Okay. Governors like Senator Dr. Efeanyi Okowa, he's doing so well. He's implemented and domesticated the Medical Residency Training Act. He has also paid the COVID-19 inducement allowances to our members in those centers. And every other things we're bringing forth, like there's some discussions at that particular level. There are other governors like, I think the Nasarawa State Governor, is also doing something in the plight towards the doctors, Now, the issue like Abia State Governor, just last week when we had a National Executive Council meeting, there was over a 2-hour discussion with the governor of Abia State. Why have you not paid? Gracefully enough, he was able to tell us that by Monday, which is today, that he would have paid the 3 months. Has he paid the 3 months now? Our members have not reported, they've not gotten any alert. You're owing someone for 19 months, and you want the person to have the zeal to go to work and attend to patients while he's also starving. Come on, we should have some human face to these things.
But we're hearing from the NARD that even if government should communicate with you that there's no going back, does it show that you're willing to resolve these issues? I'm afraid we'll have to leave it there. Thank you so much.
Thank you very much.
We hope the next time we have you, this would have been resolved.
Thank you
Julian Ojebo.
Thank you,
Thank you so much.
Thank you very much.